Hi, I'm Lil Bauer. I'm a senior psychology major with a minor in public law and political thought. I am the Comprehensive Sexual Education Director for SURGE, Students United for Reproductive Justice, and I'm also a DePaul student. We got a bunch of questions from DePaul students through a form that is on our Instagram, and I will now be answering them. All right. What are some free or cheap STD testing resources? So DePaul occasionally has pop-up clinics for STD testing. The DHS also has pop-up STD services. Usually they have rapid HIV testing, and occasionally they have additional tests and referrals. Out of Closet, a thrift store in Boys Town, has free HIV testing resources that you can also take advantage of. Someone asked, what STDs can you get from giving unprotected head? So if you are giving unprotected oral sex, you can get any STD that is spread through blood, saliva, or mucus. All those STDs include chlamydia, gonorrhea, syphilis, herpes, HPV, and they can all be spread through oral sex. This is why we really recommend that you use either a dental dam or a condom while giving oral sex or while receiving oral sex. Someone asked, what are some pieces of personal advice or resources that may be useful for queer folk to abide as the social climate of this country worsens every day? So there is the Center on Halstead. It has great social resources, just providing an opportunity for queer folk to hang out. And DePaul, that has their Center of Student Affairs for Diversity and Culture, their LGBTQ resources, and the LGBTQIA Center is very great. I really do recommend going there. NAMI or NAMI Chicago has a ton of resources, including a helpline for anyone that needs it. It is open 7 days a week, and the number is 833-626-4244. I really recommend calling there. They have something called Affinity 95. It is a Black-led, queer-led organization in Chicago's South Side that's dedicated for social justice for Black and LGBTQ communities. I would also recommend the Bisexual Queer Alliance in Chicago. Their mission is to educate and empower and provide resources for bisexual and queer persons. They have in-person and hybrid groups, so that's very great. And I also really do recommend Brave Space Alliance. It's a Black-led and trans-led organization that provides affirming, culturally competent, for us, by us, Chicago resources. Someone asked, questioning whether I'm asexual or just don't have a high sex drive. Only feel horny when I'm ovulating, but isn't that just biology? I've been asking myself this for years. Sex has never been enjoyable for me. So you may be asexual, and that's fully up to you, but you may also not be asexual. There's a couple things that may be causing that lack of sex drive or lessening in the sex drive. One obvious option, asexuality. Asexuality could definitely be what's causing your lack of sex drive. Some asexual people do experience arousal or a drive for sex, but usually to a lesser extent. Notably, asexual people do not experience any internal distress due to their lack of sexual desire. This means they personally do not care that they have a lack of sexual desire, but that does not mean that the world and everyone around them doesn't judge them for having a lack of sex drive. An other option for what might be going on is a responsive sexual desire. Many women and AFAB people experience something called responsive sexual desire, causing a perceived lack of sex drive. Responsive sexual desire means that you need to have an external stimuli in order to feel sexual desire. Women and AFAB people oftentimes only experience spontaneous sexual arousal during their luteal phase or when they're ovulating. This oftentimes leads to the idea that AFAB people have a lower sex drive, but that is not. That is only due to society only acknowledging the spontaneous sexual desire. Another possible reason could be hypoactive sexual desire disorder. Hypoactive sexual desire disorder is actually very common in AFAB people, as well as people with any mood disorder or anxiety disorder. HSDD is when a person experiences a persistent lack of or lessening in sexual desire, causing them significant distress and discomfort. Oftentimes, this is accompanied with vaginal dryness, discomfort with penetrative sex, or avoiding sex with your partner. Usually HSDD is a common side effect of a different condition, especially mood disorders and anxiety disorders, as well as hormonal disorders and sleep disorders. If you treat the primary issue of the problem, it usually will cause your sexual desire to increase. Some changes could also be impacting your sexual desire. Changes in life, changes in medication, job or schooling, moving, relationship changes, or any other change in your life could lead to you feeling uncomfortable or have some unconscious stress, making it harder for you to become aroused. Regarding anatomy, someone asked, can you only get pregnant when you're ovulating? I keep hearing different things. No. Although pregnancy has a higher chance of happening while you are ovulating, it is possible to get pregnant at any time of the month, including during menstruation. If sperm enters the vaginal canal, it can be viable for up to 2 to 3 days. When an egg is released, it can remain in the fallopian tubes and uterus for up to 12 to 24 hours. Altogether, that means that if you have an unpenetrative sex 3 days before ovulation to 1 day after ovulation, you are more likely to get pregnant then than any other time during the month. You would only know when this 4-day period is if you're constantly tracking your ovulation. This can be through ovulation test strips or basal body temperature. Basal body temperature is a body-based temperature throughout the day. During the luteal phase or ovulation, your progesterone causes the BBT to increase from 0.5 to 1 degrees. If you consistently take your BBT, you can track ovulation semi-accurately. This method of natural family planning or birth control is called the rhythm method. It is oftentimes used as a way to get pregnant or to avoid getting pregnant. One thing to note, it is not entirely effective. With typical use, the method is 76% effective. With perfect use, the method is 91% effective. A noted downside of the rhythm method is that you have to abstain from sex while you are ovulating, which is usually the time that you most want to have sex. Additionally, taking your BBT every day or using ovulation strips can be a lot of work compared to other birth control methods such as the condom or a pill. Regarding anal, is anal a porn fad or is it actually a thing? What is it even about? So anal is absolutely real. Not just gay people have anal, not just straight people can have anal. Porn paints a very idealized picture of sex, and anal is no different. Porn doesn't show the more important parts of anal, such as lube, warming up or going slow, a large conversation about safety and consent, as well as douching. I will note that you don't need to douche. Douching is when you entirely wash out the rectum with water and flush out any poop bits. But in porn, most porn actors do use enemas, which is fully going way deep inside the rectum and washing everything out. It does dry out the rectum and can cause more tearing or ripping of the skin. So I wouldn't recommend that for everyday or for personal use. Light douching or even washing the outside and a little bit of the inside with a damp cloth is recommended. All of this prep is never shown on screen. And it is a very important part that most people don't talk about. Even people without a prostate, aka AFAB people, can enjoy receiving anal. The anus has nerve endings that can make it feel good, specifically the G-spot or the A-spot. The G-spot and A-spot are inside the vaginal canal. There's a thin barrier between the vagina and the anus that allows for the G-spot and the A-spot to be hit. It should be noted that if someone tries anal without warming up or using lube, it can be super painful and tear the skin. If you're interested, my advice is to start very slow with body or anal safe toys, such as butt plugs with a flared base or beads with a flared base. The most important part is a flared base. You should definitely use plenty of lube. If it hurts, you gotta stop. Unlike vaginal sex for the first time, bleeding is a sign that it is a time to stop. Another person asked, how can my partner and I be hygienic when it comes to anal sex? Is it safe or even pleasurable to penetrate them if there's poop actively inside the rectum? So preparation for anal sex is definitely required. Without training beforehand, there can be an increase of anal fissures amongst other issues. The anus has more bacteria that can cause infection for the vagina, so it is important to have special care to minimize this risk. For example, it is not recommended to go directly from anal sex to vaginal sex, given how it increases the chance for yeast infections as well as UTIs. Some individuals opt in to use condoms to help prevent the transfer of bacteria and switch out the condoms in between each orifice. In all types of anal sex, lube is absolutely necessary. In the words of a sex educator during a presentation on anal sex, during anal, you should use enough lube that you begin to question if it's too much lube, and then you should add more. Something you'll need to accept if you're having anal sex is that shit will happen, literally. Unless you have the urge to poop, there isn't a lot left inside the rectum. Depending on your diet, there may be different amounts of stragglers left behind, especially if you have differing fiber intake. There are some people online that promote a bottom-friendly diet, so I recommend looking that up. It is controlling your amount of fiber as well as dairy and other fats, so that you have the cleanest bottom that you can have. Someone asked, what is the best way to maintain sexual intimacy long distance? There are tons of different ways that you can keep up that sexual aspect of your relationship while you are long distance. One thing you can do is mutual masturbation, whether this is you on FaceTime masturbating, you sexting while masturbating, or you can just text or call them afterwards and be like, hey, I just masturbated thinking about you. It can be a great way for you guys to feel connected and feel seen and sexy while you are apart. The technological aspect of FaceTime and sexting can be a bit scary and requires a different type of intimacy and trust, so that is an important thing to keep in mind. Another thing you can do is sexting minus the masturbation. This can involve sexy photos, saying what you want to be doing with your partner, saying what you like about them, and more. This can also involve you talking to them about previous sexual experiences that you've had and how you can't wait to do it again. A bit more of an expensive option is remote-controlled sex toys. There are sex toys that you could connect to an app on your phone to allow your partner to control them even from hundreds of miles away. LoveSense has a ton of great options, including different types of vibrators, fleshlights, butt plugs, and more. For some people, an open relationship is an option, whether that means you just hook up with other people or whether you have a full emotional relationship. That's up to you. It requires a ton of open and honest communication in order to make sure that everyone feels safe and heard. With an open relationship, you can also discuss your sexual escapades with your partner, allowing for a new area of focus with your sexting. No matter what options you use, you have to effectively communicate with your partner about how you are feeling and how they are feeling. It is important to ensure that everyone feels heard during this challenging period of your relationship. And it's also important to remember that it is going to end. It will always make you feel better if you know it's only going to last a certain amount of time. That's it. Thank you so much for listening to my beautiful video. Thank you for your questions that you asked us. If you have any other questions, there is going to be a link in the description of the video that you can fill out and send your questions to, and we will have another one of these hopefully. Additionally, you can go to our Instagram for any other resources, including our womb service, where we pass out peer-to-peer contraception off campus. And let us know if you have any other comments, questions, or concerns. Thank you.